Morning students, today we will discuss the oculomotor nerve. So oculomotor nerve, it is the third cranial nerve. Now what are the different functional components of this nerve? That is, first functional component is the special somatic efferent. So functional components of this nerve is these special somatic efferent, they are going to supply the extrinsic muscles of the eyeball except, so all the extrinsic muscles, they are supplied by a special somatic efferent of the oculomotor nerve except lateral rectus and superior oblique, along with levator palpebrae superioris muscle. So these fibers are going to supply these structures. Next is the general visceral efferent. So general visceral efferent fibers, they are arising from the Edinger-Westphal nucleus of the oculomotor nerve, and they are going to supply the sphincter pupillae muscle, which is basically the constrictor of the pupil, which causes the constriction of the pupil, and ciliaris muscle, which is responsible for the accommodation. So these are the functional component of the oculomotor nerve. Now coming to the course of this nerve. This oculomotor nerve has two sets of nuclei, that is main motor nucleus and Edinger-Westphal nucleus. So these two nuclei, they are lying in the midbrain, and both these nuclei, they form the oculomotor complex. So here I would like to tell you that main motor nucleus fibers, they are the special somatic efferent fibers which are going to supply all the extrinsic muscles of eyeball except lateral rectus and superior oblique. Edinger-Westphal fibers, these are the general visceral efferent fibers which are going to supply the sphincter pupillae and ciliaris muscle. And both these nuclei, they are lying in the midbrain, and in combined form we call them as oculomotor complex. Now when the fiber they start or they leave the midbrain, they leave the midbrain from the medial side of cerebral peduncle. So they come out from the brain on the medial side of cerebral peduncle, side of cerebral peduncle. They leave the midbrain peduncle. Then next step, after leaving the midbrain, this nerve is lying between superior cerebellar artery and posterior cerebral artery. So this is next step where it is lying. Then after that, this nerve, it pierces it lies in the subarachnoid space. Then it pierces the arachnoid matter. Then it pierces the inner layer of dura mater. After piercing the inner layer of dura mater, it come and lie in the lateral wall of the cavernous sinus. So along with this nerve, other nerves which are lying in the lateral wall is trochlear nerve and abducent nerve, and ophthalmic and maxillary division of fifth nerve. So they are running in the lateral wall of the cavernous sinus. Now after that, at the anterior end of this cavernous sinus, at the anterior end of the cavernous sinus, this nerve, it divides into two rami. So what are those? Superior ramus and inferior ramus. So it divides into two rami, that is superior ramus of oculomotor nerve and inferior ramus of oculomotor nerve, and after that it enters into the orbit through the superior orbital fissure. So you can see the superior ramus of oculomotor nerve and inferior ramus of oculomotor nerve, which is running in the tendinous ring which is present here. From this tendinous ring, the different recti, different muscles of the eyeball, they are just arising. So recti muscle are arising from this. So you can see here. So superior ramus of oculomotor nerve and inferior ramus of oculomotor name is given here. Why? Because at the anterior end, this single oculomotor nerve is dividing into two. So it is entering into the orbit. So once it is entering into the orbit, so its fate is to supply the different muscles. So this diagram is showing the distribution of the nerve. So in the orbit, it supplies, that is superior ramus. This is the superior ramus of oculomotor nerve, which is going to supply the levator palpebrae superioris and superior rectus muscle. This is the inferior ramus of the oculomotor nerve, which is going to supply the medial rectus, inferior rectus, and the, you can see here, that is inferior oblique muscle. So these three muscles are supplied by inferior ramus. These two muscles are supplied by superior ramus. Lateral rectus, we know it is not supplied by the oculomotor nerve because it is supplied by the sixth nerve. So this is regarding the course of the nerve and its distribution. So what are the different branches are given by this? Now the fibers which are arising from the, these fibers which are going to supply the muscles of eyeball, they are basically the fibers coming from the main motor nucleus of the oculomotor nerve. Now the fibers which are coming from the Edinger-Westphal nucleus, the fibers arising from the Edinger-Westphal nucleus, they just pass to the ciliary ganglion, and after the relay in the ciliary ganglion, they supply the two muscles, that is ciliaris and sphincter pupil. So this is the fate of this nerve. Rest of the course, no doubt all the fibers, they are running along with this nerve, because I told you that oculomotor nerve is the combination of fibers which are arising from the main motor nucleus and Edinger-Westphal. But the fibers which are running in a single nerve, they have different fate. The fibers which were arising from the oculomotor nucleus, motor nucleus, they are going to supply the different muscles of the extrinsic muscles basically, and these are the intrinsic muscles. These intrinsic muscles are supplied by the Edinger-Westphal nucleus fibers. So this is all about the course and distribution. Now, if the oculomotor nerve is injured, so what will happen? So if the levator palpebrae superioris will go, so if we see the applied of this, if the fibers, that is levator palpebrae superioris will go, that will lead on to the ptosis, partial ptosis. So that is because of the injury to this levator palpebrae superioris, but superior oblique is intact. So that's why I am saying partial ptosis. Then second applied is squint. So what is going to happen? That is definitely medial rectus is supplied by the oculomotor nerve. So what is the action of medial rectus? If I am talking about this eye, the action of the medial rectus is to move the eyeball on this side. But the lateral rectus is supplied by sixth nerve, it is intact. So once this injury will happen, medial rectus is not able to move the eyeball towards the medial side. number one. Number second is unopposed action, which is done by lateral rectus. So lateral rectus will pull the eyeball towards the lateral side because lateral rectus is intact. So which squint is there? That is lateral squint. Then next is, if the fibers oculomotor nerve is injured, so definitely a Dinger-Westphal nucleus fibers will be affected. So accommodation will be lost because ciliaris it goes. Then there is dilatation of the pupil because sphincter pupil is affected. So dilatation of the pupil, it happens because the sphincter pupillae is involved. So this is all about the applied aspect of oculomotor nerve and the course and its distribution. If any doubt is there, so you can ask in comment box. So thank you very much. Kindly like, share and subscribe my channel. Thank you very much.